Hello everyone. So my presentation today is about patient safety and the importance of it and how it's developed over time, because I think it's fair to say over the last 10 years there's been a considerable change in patient safety and how much it's actually factored upon in healthcare, in different healthcare settings as well. Just a little bit about myself. So I initially started my healthcare journey in a primary care trust and then moved over to a clinical commissioning group. Not long after that time, I moved to London and started working at the Harley Street Clinic and moved to another provider organisation where I worked in primary care again, community services and remote radiology. And now I'm working for a home care provider called Hometouch, and we currently provide regulated care and introductory care to care recipients across the whole of the UK. So in terms of my insight to patient safety, I've seen it from a number of different spectrums, from that direct provider setting, but then also from that commissioning angle as well. So when we think about patient safety, the World Health Organization state the following: the simplest definition of patient safety is the prevention of errors and adverse effects to patients associated with healthcare. So for me, I just thought about this and I said to myself, so what does this actually mean? Healthcare is becoming more effective and complex and at the same time. So all of these things are happening at the same time together. This is due to the increased use of technologies, medicines and treatments. So we need to ensure that we have the right systems, the correct systems in place to reduce risks of things going wrong. Why is patient safety so important? So for me, when I think about patient safety, I feel it's important because it helps to shape services. So if we look at the Hogan, Darcy and Black analysis, it was stated that 3.6% of hospital deaths in England have a 50% or more chance of being avoidable. This percentage equates to approximately 150 avoidable deaths. Patient safety also helps to improve culture. So recommendations from the Francis report, which I'm sure you're all aware of, demonstrates that culture and leadership come hand in hand together, and these two important factors are key to instilling a positive patient culture in an organisation. This also promotes a clear vision for quality so that staff are able to recognise that they are delivering high quality, clinically excellent, safe and patient-centred care, which is the focus for all organisations. Leaders should be able to provide consistent and clear organisational goals to ensure that they have the accountability in the organisation, and this also helps to improve care. Having a culture in place outlines responsibility for everyone in an organisation and helps to create that safety culture that we all want to have. And this does not differ from different healthcare settings. So whether you're commissioning based, whether you're provider based, it's all the same. We're all accountable when it comes to patient safety. Previously, when I used to ask an audience or a group of people about who was responsible for patient safety, everyone used to go quite quiet. So I'm just going to ask a question actually right now and just see what everyone's thoughts are. So if you think about patient safety, who's actually responsible? Perfect. So everyone, we're all accountable. Great. We're all responsible when it comes to patient safety. So I like to stress to everyone, regardless of what your role is in an organisation, we're all responsible. So if we know that something is going wrong, we should be able to voice those concerns. Patient safety is important as a safety culture helps to encourage learning, which also improves the quality of care and in turn motivates staff to provide high quality care. So we want to see that happening. We want to encourage learning in an organisation. Having a safety culture in place also helps to break the barriers down as well, and it helps to promote more openness and transparency, which is what we need in an organisation to ensure we're able to provide high quality care. A safety culture also improves patient satisfaction. By involving patients in the consultation process to improve the safety of services, their satisfaction will increase, but then also from an organisational perspective, job satisfaction will also increase. I've got a quote here, which I'd just like to give you a little moment to have a read to yourself. So with this quote, if we work on the system to eliminate problems, then we will have a greater chance of reducing risks occurring in an organisation. want to think about developing culture of care, learning needs to be encouraged to assist in developing a safety culture. We need to use different ways to share learning across an organisation, and one way that I've seen, or several ways I've seen actually, of doing this is by putting up lessons learned posters, having some group learning and organisational learning via newsletters. So what I used to do in some of my previous organisations was to send a monthly newsletter out and capture the key lessons that we've actually pulled out from incidents that have occurred, your root cause analysis investigations and your complaints as well, giving everyone an update in terms of the safety alerts as well, and national guidance of what we've implemented to make sure that everyone's aware of what's happening, and it's not just for the quality or the governance teams to look into, but everyone's aware of that. And that shows that you've got the cross-organisational learning coming through, and it actually promotes more questions about what's happening in the organisation from all departments. When something goes wrong in an organisation, the first step is to accept that this has happened. So for example, if a surgery hasn't gone to plan or the wrong treatment has been provided, we need to have that acceptance there to actually move forward and say, right, what do we need to do? This will empower staff to voice their concerns when things go wrong and be able to speak up about it. And everyone should feel that they can do that without feeling scrutinised. So if we know that something has happened that shouldn't have happened, or we've seen someone do something that they shouldn't do, we should be able to voice that. Human factors examines the relationship between human beings and the systems with which they interact by focusing on improving efficiency, productivity and job satisfaction with the goal of minimising errors. Human factors can show us how to make sure that we use safe prescribing practices, communicate effectively with one another and hand information over to healthcare professionals as well. These tasks have become quite complicated as a result of the increasing complexities of healthcare services and the systems that we have as well. So previously, it may have been easier to do this, but now there are so many different steps that we need to take to make sure that we have handed information appropriately to the next person. When we think about patient safety and systems, so system design for me I think is still improving, and from what I see in the national sphere as well, it still needs to improve. This is inclusive of the devices, the equipment and information that we all use. Having the right systems in place helps to ensure that our patients are treated in a safe environment. The WHO have actually said that there is a 1 in a million chance of a person being harmed whilst travelling by plane. In comparison to healthcare, where there is a 1 in 300 chance of a patient being harmed during healthcare. Again, we just need to stress that the right systems need to be in place to reduce the risks occurring in that healthcare setting. Responding to safety alerts, embedding national guidance is another way to ensure that systems work effectively. Having processes in place to ensure that there are mechanisms to systematically address such aspects will demonstrate accountability in an organisation and promote high quality care being delivered. The Swiss cheese model, so I'm sure you've all seen this previously. So the Swiss cheese model originally came from James Reason in 1990 from the book he published called Human Error. In his book, he explored the Swiss cheese model and demonstrated that each piece of Swiss cheese acted as a barrier, and the holes within the cheese represented flaws and hazards. In a typical system, there are many steps, barriers essentially, that provide opportunities to stop an error. However, each step may have multiple flaws, so the holes essentially, that can allow an error trajectory to progress to the next step. So for example, a nurse administers the wrong medication. If we look at this scenario, the prescriber in this situation prescribed the wrong medication. The pharmacist was short-staffed and didn't notice the error. And also, as a result of those staffing problems, this caused the nurse to administer the wrong medication. In this situation, if we think about what's happened, these hazards have fallen through the holes, and essentially we could have stopped this from happening at an earlier point if we just reviewed those processes and made sure that we covered the right checks that we should be doing. Looking at the developments in patient safety, duty of candour evolved from the Mid-Staffs incident, and it's enshrined in Regulation 20 of the Health and Social Care Activities. Duty of candour imposes an obligation on organisations to report certain incidents that meet the statutory criteria for duty of candour to the CQC. So for me, this is something that has changed considerably for organisations, and now everyone's talking about it more than before, and we're able to spot these incidents easily than we were previously. Learning from deaths is a really key one for me as well, because yes, it's important for the healthcare trust, for hospitals, but we also have to think about the primary care element and also the care settings as well. So for care homes, for home care providers as well, it's really important to make sure that there is some sort of a mortality review happening so that you can actually engage in the lessons learned process as well. So learning from deaths is important when you look at all your expected deaths and your unexpected deaths as well. Recent reports from the Royal College of Physicians outlines that hospitals are learning from deaths to improve patient care. The publication of learning from deaths by the National Quality Board in March 2017 mandated all English trusts to conduct mortality reviews, a move which was supported by the RCP's National Mortality Case Record Review, the NMCRR programme. The NMCRR programme developed the structured judicial review process to effectively review care received by patients who have died. The SJR has made positive contributions to improving healthcare for patients. So, for example, one healthcare trust introduced medical examiners, and this process actually helped to screen all the deaths in 2017. So within 6 months, they actually managed to screen 97% of the deaths. The results from this actual examination informed improvements to the end-of-life care process, which included promoting patient choice, encouraging a formulation of care plans in the hospital and community, improved sepsis recognition and treatment, and increased awareness to DNA CPR as well. By using a standardised approach, trusts can effectively improve quality in care and also patient safety. Learning from incidents is really crucial as well. So it's great that we can raise awareness of things that have gone wrong. For example, with the baby Joshua incident, so there are a number of failings that occurred in that actual scenario, and it's only this year, approximately 10 years on, that the Professional Standards Authority produced a lessons learnt report into the death that occurred. Again, Dr. Bawagaba, the case also indicated systematic failings which led to the terrible events of Jack's death. The Winterbourne View report showed that abuse that took place was criminal as well. The Patterson case demonstrated the importance of making sure that concerns are not ignored. The Healthcare Safety Investigation Branch became operational in April 2017. They aim to raise standards to improve patient safety to support learning across the healthcare system across England. And again, the CQC have been working on improving and strengthening the inspection format. An increase in incident reporting shows that there are more no harm and low harm incidents being reported across the whole of England as well. We also have the draft Patient Safety Bill. So the Health Service Safety Investigations Bill will establish the Health Service Safety Investigation Body, an independent safety investigation body to conduct investigations into patient safety incidents, not for the purposes of finding blame, but to address the patient safety risks. So it's really good to see that we're taking away the blame culture, which is essentially what we need to do. We shouldn't be going forward for, I guess, highlighting that someone was responsible in this way and blaming them. We need to think about the systems as well. What systems were involved in that actual process? Sir Robert Francis recommended the establishment of a national network of Freedom to Speak Up Guardians to support people to come forward with safety issues, and this has really helped. So something that I've seen from connecting with other individuals and going through to other conferences as well, that there's been an increase in people being able to speak up, which is what we want to see happening. The NHS is also working to achieve the national maternity ambition to reduce the 2010 rate of stillbirths, neonatal deaths, maternal deaths and brain injuries that occur during or soon after birth by 20% by 2020. The national ambition for this is to reduce this rate by 50% by 2030. By 2020 and 21, the NHS predicts that the number of healthcare associated infections will fall by 50%. The NHS is also developing plans to reduce the level of medication errors across the NHS, ensuring that patients receive the right drug under the medication rights. And finally, Always Events. This initiative provides an opportunity for patients to be involved in determining events that they feel should always happen in their care. For me, this will result in an improved safety culture. Does anyone have any questions? Thank you for your time.